Hi, I'm Ken Moore, Director of the Adolescent Hospital at Parkside Psychiatric Hospital and Clinic, and I'm also the chair of the Zero Suicide Committee. Parkside adopted the Zero Suicide approach in 2018 so that we can make suicide a never event. To accomplish that, we provide 24/7 access to emergency services. We also provide hospital care to children, adolescents, and adults who are at high risk of dying by suicide. Our programs practice state-of-the-art assessment and screening of suicide. We provide best evidence-based safety plans to help patients after they leave. We collaborate with patients and families to make sure that the environment is safe after discharge by reducing access to the means of suicide. But what about after hospitalization? Studies show that a large majority of deaths by suicide occur within 1 month of discharge from the hospital. Another study shows that 7 out of 10 individuals discharged from the hospital after attempting suicide either failed to keep their outpatient appointment or dropped out after only a few sessions. We know that follow-up makes a tremendous difference in helping individuals at risk of suicide stay alive. That's why Parkside implemented a process of follow-up for individuals discharged from the hospital who are at risk of suicide. At first, we contact patients frequently. We talk with them about attending their outpatient sessions. We remind them to use their safety plans. We problem solve any obstacles that come up. And we maintain contact over time. Why do we do that? Well, research clearly shows that following up after hospitalization reduces the rate of suicide by a great degree. And it can be any contact: phone calls, emails, texts, cards, letters. It doesn't have to be anything major. Simply letting someone know that you're thinking of them and that you care about their well-being can literally save their lives. So if you're a mental health professional, consider how you might stay in touch with your clients through text, emails, maybe a note, to remind them of available help, emergency resources, the National Suicide Prevention Lifeline. If you are a loved one or a friend of someone at risk of dying by suicide, follow up with them with a phone call, an email, a text. Anything can make a difference. We all know how important support is for all human beings. It's particularly important that we follow up and maintain contact with individuals at risk of suicide. That follow-up can literally be life-saving. Every time you follow up with a person at risk of suicide, you bring us one step closer to making suicide a never